So welcome to today's MCQ review on heme and hemoglobinopathies. So that was the first MCQ for this series. So question 1 says, a 62-year-old man being treated for tuberculosis develops a microcytic hypochromic anemia. Ferritin levels are increased and marked sideroblastosis is present. A decrease in which of the following enzyme activity is most directly responsible for the anemia in this man? Since the man is being treated for tuberculosis, the drug likely being used is going to be isoniazid. So an isoniazid actually inhibits the conversion of vitamin B6 to pyridoxal phosphate by inhibiting the activity of the kinase enzyme. So pyridoxal phosphate, it's a coenzyme for ALAS, that's ALA synthase, and this is responsible for converting glycine plus ursinyl-CoA into delta amino levulinic acid, and vitamin B6 PLP was the coenzyme here. So if PLP is absent, ALAS wouldn't function well. So the enzyme that was affected was delta amino levulinic acid synthase. Identify porphyria that does not have accumulation and increased excretion of delta amino levulinic acid and porphobilinogen amongst the following. The answer to this is congenital erythropoietic porphyria. The rest have increase in PBG and ALA. So there's increase in PBG and ALA in the others, except for congenital erythropoietic porphyria. Question 3. A 48-year-old man develops abdominal colic, muscle pain, and fatigue. Following a 3 weeks hospitalization, acute intermittent porphyria was initially diagnosed based on a high level of urinary delta amino levulinic acid. Subsequent analysis of the patient's circulating red blood cell reveals that 70% contained elevated levels of zinc protoporphyrin. So when I see zinc protoporphyrin and diagnosis was corrected, the correct diagnosis is most likely this patient has lead poisoning. So lead poisoning was the issue here, and the enzyme that was inhibited was actually called ALA dehydratase, and ALA dehydratase was the enzyme inhibited by lead poisoning. Question 4. Porphyria cutaneous tarda is the most common porphyria characterized by photosensitivity and skin lesions. Which of the following statements is false regarding porphyria cutaneous tarda? Now, don't forget, I told you guys that heme synthesis has 8 steps. So the first step happens, this is the mitochondria. Step 1 happens in the mitochondria. Step 2 is here. Step 3 is here. Step 4 is here. Step 5 is here. Step 6 happens in mitochondria. Step 7 happens here, and the final step also happens here. And we said the mnemonic for the disorders of heme synthesis is what? Let us sack. That's SAAC Port Harcourt, very expensive personality. So S stands for sideroblastic anemia. A stands for ALA dehydratase deficiency, deficient porphyria. Second A stands for acute intermittent porphyria. C is congenital erythropoietic porphyria. The next P is porphyria cutaneous tarda. So in porphyria cutaneous tarda, there is usually no accumulation of ALA and PBG. So this is the odd one here. So this answer is the wrong one here. So to finish up, H stands for hereditary copoporphyria, V is variegata porphyria, and EP is erythropoietic porphyrias. For question 5, approximately 1 milligram of iron needs to be replenished daily from dietary source. The absorption of dietary iron is facilitated by divalent metalloprotein transporter 1. Iron is absorbed in which state? We said it before, is absorbed in the ferrous form, the Fe2 plus form, because this is divalent. The divalent means it needs molecules with 2 plus on their head to be able to absorb them. In HBS, glutamic acid replaced by valine. Yes. So what will be the electrolytic electrophoretic mobility. Since valine is neutral and glutamic acid is negatively charged, so it means that the normal HbA will move towards the positive pole of the electrophoretic film. So this is positive pole, the negative pole. So if I put HbA here, this is HbA. HbA, the negative charge, will move towards the side. But HbS, which is here now, because of the valine, it would relatively not move. So the mobility will actually be decreased. So that's the answer here. Question 7. A boy with staining of teeth and raised corproporphyrin 1 levels and increased risks of photosensitivity. The enzyme likely deficient is uroporphyrinogen 3 co-synthase. So that's the enzyme that is deficient. You can go back to the lecture note and see. This is called erythrodontal. That's the staining of the teeth is called erythrodontal. Sickle cell anemia is the clinical manifestation of homologous gene for an abnormal hemoglobin molecule. The mutation event responsible for the mutation in the beta chain is called point mutation. So there's a point mutation. GAG was replaced by GTG in the coding strand, like we discussed. So when this was the coding strand, in the coding strand, this was the problem here. There was a replacement of T with A. So this was a point mutation. So when mRNA was made and the whole process of transcription and translation happened, we found out that the normal codon that was to code for glutamate was no longer coding for glutamate. Instead, it was coding for valine. So this was the problem that happened. Question 9. Heme proteins that serve as electron carriers in respiration, photosynthesis, and oxidation reduction reactions are called cytochromes. A 67-year-old man presented to the emergency department with a 1-week history of angina and shortness of breath. He complained that his face and extremities had a blue color. His medical history included chronic stable angina treated with isosorbide dinitrite and nitroglycerin. These drugs actually increased levels of free radicals in the blood. Blood obtained for analysis was chocolate color. So this chocolate color is significant. Which one of the following is most likely that this patient had methemoglobinemia? So in methemoglobinemia, the Fe2 plus of the hemoglobin was actually giving an electron to some free radicals here, and it became Fe3 plus. So this Fe3 plus does not have good affinity for oxygen like Fe2 plus does. So this is the concept of methemoglobinemia. Question 11 says, each of the following statements about heme and iron metabolism is correct, except the answer is option C. Delta amino level linked synthetase. Synthetase is not the enzyme, it's actually a synthase. Question 12. Which of the following statements about adult hemoglobin is true? HbA is composed of 2 beta and 2 gamma. No, it's actually 2 alpha, so this is wrong. 4 subunits combine to form primary structure of hemoglobin. They didn't state the 4 subunits of what. Each subunit of hemoglobin contains a heme, that is true. HbA binds 1 mole of oxygen per mole of protein. Actually binds 4 moles of oxygen in all. The beta chain of HbA is more hydrophobic. No, it's actually hydrophilic. It's actually more hydrophilic than it. So the beta chain of HbA is more hydrophilic than HbS. When excess amounts of iron are present in the diet, the excess iron is stored as well. The answer is ferritin. Excess iron is stored as ferritin. Glycine plus succinyl-CoA giving amino levulinic acid plus coenzyme and CO2. This reaction is biosynthetic pathway for heme is the final product of this pathway. And hemoglobin electrophoresis is based on charge and mobility. So this is the conclusion of this MCQ review.